Well, welcome to today's video. Today we're going to look at the United States, the United Kingdom, and I've also got some, it has to be said, distressing news from South Africa. And we also want to look at the slightly concerning situation in Australia as well. So let's just dive straight in here with the United States. Now, as you probably know, the cases are increasing in the United States. Getting on for the 3.5 million mark, an extra 315 deaths in 24 hours. It's got to be an underestimate. But that means there's been 135,235 deaths in the United States at the moment. And if we can compare that figure to the total figure, that gives us a death rate of 4%, case fatality rate of 4%. So this indicates that this figure is a significant underestimate. How much of an underestimate, we don't know. It could be by a factor. It could easily be 20 million people infected in the UK at the moment in terms of real figures. Giving a death rate of probably nearer what we would expect, more around about the half, 0.5 to 0.7% rate. So that's definitely an underestimate. In fact, the CDC are saying that the real figure could be about 20 million at the moment. Now, the CDC are making forecasts, so this is quite gruesome really, but there's 135,000 deaths at the moment, and their forecast is in the next couple of weeks there could be anything between a total of 140,000 deaths and 160,000 deaths. So that's between sort of 5 and 25,000 extra deaths in the next few weeks in the United States, according to the CDC forecasts. And the way things are going at the moment in terms of the increasing cases, unfortunately, I wouldn't be surprised if we're much nearer to, in fact, I would expect us to be on about 160,000. Another 25,000 deaths in the next 2 weeks is by no means impossible in the United States, unfortunately. And that would be within the bounds of CDC current modelling and forecasts. And the CDC go on to say there's increased death rates in Now, what the CDC actually say here is that the deaths in the next 14 days are likely to be higher than the deaths in the previous 14 days in these states. So in other words, increasing death rates, according to the CDC, are expected in Arizona, Alabama, Florida, Idaho, Montana, North Dakota, Nevada, Ohio, South Carolina, Tennessee, Texas, US Virgin Isles and West Virginia. So in all of these states, the CDC is expecting the death rate to be higher in the next 14 days. And I think that that is very likely to be the case, unfortunately. In fact, it's inevitably going to be the case, because the cases are increasing now and we know we have this lag effect. So California, basically, 329,000 cases, well over 7,000 deaths. Los Angeles County is a bit of an epicenter. That's one of the worst affected areas. So basically, California have closed down indoor venues, including non-critical offices. So basically, we see all the indoor areas essentially closed down in California, and a lot of beaches closed as well. In fact, as far as I know, pretty well all the beaches in California are closed. So we've got a full lockdown really in California. Now, I mentioned the oil tanker here because what we have is COVID-19. You carry out an intervention, and then, as we know, you've got the incubation period, the sick period, the time when people can become critically ill, then tragically some deaths, and then they have to be collated, and then they have to be reported, and the reports have to be published. So we have this long delay. We have a month's delay between an intervention, or a month or two sometimes delay between interventions and their effect on deaths. The cases are often affected quicker. So there's a big lag here. So if California is completely closed down again, the cases are going to continue to rise for the next couple of weeks probably. And the deaths are going to continue to rise perhaps for the next 4, 5 or 6 weeks before we see the benefit of this shutdown. It's a very frustratingly slow process because it's not a sports car that screeches to a stop. It's an oil tanker. You've got to take the momentum out of it. and it keeps drifting on for a long period of time. And that's the way this pandemic is working, unfortunately. So it's going to be a long time. It's going to be weeks before we see the effect of this renewed lockdown in California. And of course, all this time, people's livelihoods are being lost. It's a remarkably difficult situation. Now, Florida, again, over 250,000 cases in Florida, another 132 deaths in a 24-hour period. And Miami, this is another thing that's concerning. We have talked about this on several times. But in Miami, at the moment, 25% of the tests that are being done are coming back positive, indicating there's a lot of virus endemic in the community at the moment. And of course, this is going to feed through into poorly patients and into deaths. Now, this is one of the senior doctors from Florida, Dr. Marty. She says we are exploding. So this is a senior doctor using this sort of phraseology. Obviously, she's very concerned. She says there's been a lack of a unified approach. Population was not convinced of the serious nature of the risk. Beaches, bars, protests and masks. So beaches were open. People were going to bars. People were taking part in mass protests. And people were not wearing masks. Therefore, the problem is now in Florida as it is. She said a lockdown may be required to reverse the situation in Florida, but politically, that does not seem to be on the table. So we've got greatly escalating cases. We've got 25% positivity. We've got no political will for a lockdown. That means there's going to be exponential growth in Florida for the next few weeks. And large proportions of the population are going to become infected. And several percent of those will become critical. And the case fatality rate will probably rise because the medical services will be overwhelmed by this huge amount. Because if there's not the measures being taken to stop it, we know that the R0 can rise to 2 or 3. The uncontrolled R0 over winter in the UK, we looked at a couple of days ago, is estimated to be 1.7. Previously, it's been as high as 2.7 without the mitigation measures. And as things are at the moment, these do not seem to be being taken in Florida. So more information on Florida to come, but that's kind of the review. Now, not in this video, I'm planning another video with more detail on that. New York, of course, had a terrible time, but now things are much better. And New York have imposed a 14-day quarantine on 22 states, the worst affected states. 14 days. People must provide the information at the airport of where they're going to be quarantined. And this is legally enforced with large fines. Only it's not. Or it hasn't been so far. Other places in the states that have imposed enforced quarantines have not enforced it, in fact. It hasn't happened. Now, New York could be the first. Let's hope it is. Let's hope it is enforced. But even if it is enforced, the problem is, and you know all this now, the problem is that if someone is quarantining themselves and they don't have a house to themselves, and they turn out to be infected and other people are coming and going from in that house, then that second or third or fourth person in the house is free to spread the virus. So it's by no means a panacea for preventing the infection of the spread of infection. And what about people driving into New York? Well, if people drive into New York, then they have to fill out an online form. But there's an awful lot of people driving to New York. Will this be enforced? I suspect not. I suspect people will be able to do what the heck they want, the same as they've done in other previous enforced quarantines. Let's hope I'm wrong and it is enforced this time. Well, let's hope it doesn't need to be enforced, for goodness sake. I mean, people should be doing this anyway. This is what we should be doing. Now, moving on to the UK. England only. This is based on positive tests. Now, I find it sometimes useful to look at these sort of sequences of figures. So now what we've got here is it's 1, 2, 3, 4. The last 4 or 5 days. Those days. Sorry, that data there for the last few days isn't accurate because these numbers have not yet. These numbers are going to rise because the data's got this lag in it. So what we have is we have this. Have we got a slight increase there? Kind of not really. This is where the data is valid too. So this figure here for the 9th of July, that won't increase. But this figure here for the 10th of July will increase. So are we seeing so the lockdown was greatly eased on the 4th of July. Are we seeing increasing cases? The answer is not yet, but we've only had 11 days. So has the easing in lockdown resulted in more cases in the UK? The answer is we don't know yet because it's only been 11 days. And we have this oil tanker effect. Will they increase over the next few weeks? I strongly suspect so, unfortunately. But as of now, I'm pleased to say it hasn't. As the data fills out for the 14th, 13th, 12th, 11th, 10th of July, these numbers are going to increase. The question is, will they show an increasing trend? But the other thing that's concerning is this official data. The King's College app is showing that there's nearly 1,500 new cases per day in the UK. So which is correct? Well, my hunch, unfortunately, is that's more likely to be correct. But again, the good thing is this has trended downwards for some time. So the King's College self-reporting app data has trended down for some time as well. So indicating the trend is definitely down. So that is encouraging. The case is what's it going to do in the next few weeks as a result of the 4th of July easing of restrictions is the big question. Now, the King's College group, Professor Tim Spector group, have come up with something fascinating that I am going to report on in detail because it's really interesting. Skin rashes should be considered as a 4th key sign. So we know there's many features, but people are particularly likely to get the fever and the cough and the anosmia, the lack of smell. These are the classic features. But this is saying skin rash could occur. And it seems that skin rashes are occurring in up to 16% of people that are infected. Now, more information on that later, as I say. I'm going to prepare a separate video on that when I get time to do that because it's very interesting. But this looks like this pandemic has been going on since January and people haven't realised the importance of skin rashes, that up to 16% of people who are positive for COVID-19 may have a skin rash at some point in the illness. So a very important clinical indicator that seems to have been missed but turned up by this app where we have about 1 million people reporting including me. So more on that later. Now moving on to South Africa. In fact, let's look at the screen here. So here we have, now this is the new confirmed COVID-19 cases per million. So this is already adjusted per capita and we're using the logarithmic scale here. New confirmed COVID-19 cases per million per day. And we see that this is the United States here. So South Africa has actually got slightly higher numbers than the United States at the moment, which is really quite surprising. But of course, this is when we look at it per capita for the amount of people in the United States. So South Africa actually more cases per capita than the United States. Brazil seems to have levelled off, but of course, the Brazilians have been fiddling around with the way they report the data. They changed the way that they report the data. So I suspect the real cases in Brazil are actually higher. But here we see South Africa has got more cases than Brazil and the United States. Well, we're not sure about Brazil, but for sure than the United States per capita. So the problem in South Africa is escalating. But when we look at deaths, what are we on here? So when we look at deaths, again, I'm using the linear scale here of deaths. And again, this is adjusted per million people. So this is per capita. So we see that the deaths in Brazil are way higher than the deaths in the United States. Now, this is not surprising because the medical care in Brazil is nothing like as good as it is in the United States. And that will cause a much higher proportion of deaths, because where someone could be treated with oxygen for a few days in the United States and survive, in Brazil they might not get that simple intervention and die. So that is not too surprising that the rate is higher in Brazil, the death rate, than in the United States, even though the overall cases probably aren't too different per capita. But South Africa, we see the death rate is dramatically lower. And as we'll see, there are significant health challenges in South Africa. So to be quite blunt, I don't accept this South African death figure as being lower than the United States. I suspect that is not an accurate report, and hopefully future data will clarify that. So moving on to South Africa now for more detail, and there's no two ways around it. This is distressing. I'm going to go through it as objectively as I can, and but it's difficult. It was difficult to prepare. Port Elizabeth, Eastern Cape. Various staff have been on strike at various times, and a lot of staff are off sick because they've caught the virus. So that's not good. Different groups of staff on strike or off sick at various times. And the thing that really is distressing about South Africa is the perinatal deaths. Now, of course, all the time, we've talked about what we might call the collateral damage of this pandemic. People that are dying because healthcare facilities are not available. And that seems to be the case in South Africa, and it is distressing, as we'll see. So there's been a lot of perinatal deaths. Now, this report is largely from the BBC, who've done a comprehensive survey there, down for quite a few hospitals. So do click on that, read this for yourself. Direct quotes from senior doctors. An epic failure of a deeply corrupt system. Epic failure, deeply corrupt system. So there is endemic corruption in South Africa. That is expressed, especially in the Eastern Cape, in the healthcare sector. This is a doctor who works there all the time. Institutional burnout, a sense of chronic exploitation. I think that was actually the same senior doctor that said both of those. The Department of Health essentially bankrupt, and a system on its knees with no strategic management. So corruption, disorganisation. There's a huge amount of fear and mental and emotional fatigue in the staff. We were working with a skeleton staff before COVID-19, and now we're down another 30%. Services are starting to crumble under the strain. This is all from senior doctors in South Africa, in this Port Elizabeth area. COVID has opened up the chronic cracks in the system. It's a chronically corrupt system. The reports that patients have been fighting for oxygen was confirmed. Patients actually fighting to see who gets the oxygen mask. Comparing it to a war situation, I saw the pictures on the BBC. I can't show you them for copyright reasons, but blood and waste on the floors, rats, lack of personal protective equipment, oxygen shortages. Also severe shortage of ambulances, very poor ventilation in the hospitals, and we know that ventilation is absolutely pivotal in this. That is really bad. The viral loads will build up. Patients sleeping under newspaper, and hospital pictures of the hospital infested with rats. Now, just on a purely personal note, I have actually been trying to interview a nurse or a doctor from South Africa, and I've been in contact with several, but none of them were prepared to come online, and they'll talk to me one-to-one, but they won't. I haven't found anyone who's prepared to risk being filmed because of the fear of repercussions, which of course is ominous in itself. A senior nurse says, every day I come to work in fear. The infection numbers are going up. Every day we've got chaos. So disorganisation and corruption. Maternity care. Lots of pregnant women all over the wards. Mothers and infants have died. Senior medical person or midwife, I'm not sure, but a senior person in the hospital. I was personally involved in the delivery of 2 dead infants and know there were more. This is very unusual. To have several mummies and babies dying in 1 week in one hospital is totally unheard of and unacceptable. You know, all these babies needed was a bit of help for a couple of weeks, and they could have lived a productive life for the next 90 years, but they didn't get it. It's just trying not to get annoyed, but the fact that corruption results in the death of babies. One person takes resources and money for their own personal greed, and children die. What greater indictment than that can there be? The deaths seem to be caused by lack of health care. Pregnant women, I mean, in all, you know, childbirth is a dangerous time of life. You know, you must have a medical backup for childcare. A minority, most mothers, of course, will have a perfectly physiological delivery, but some will not. And in South Africa, for example, you get a fair bit of cephalopelvic disproportion where the size of the baby's head is too big to fit through the birth canal, and the woman will stay in labour for 3 or 4 days. Then eventually the fetus the unborn baby will die. Terrible, just through lack of. Well, it's not simple for me, but for obstetrician gynaecologist, caesarean sections are a very straightforward procedure, and people are dying because of lack of this availability. Pregnant women waiting for days, sometimes lying in corridors, waiting for urgent surgery. Not me speaking, this is the staff there speaking. Confirmed reports of an unusual number of stillborn infants in recent weeks. Again, all these children needed to do was get through that few weeks and everything would have been great, but they didn't make it. Provincial health department was generally seen as inept and dysfunctional. That private donors, businesses and charitable trusts anxious to help in the fight against COVID-19 were refusing to deal directly with it, largely because of corruption and incompetence. In Eastern Cape, the President of South Africa says the storm is upon us, which is self-evident. My question would be, what are you going to do about it? Now, finally today, Australia. Now, let's just look at the graphic from Australia. So, Australia had been doing so well, and then the number of cases started going up, largely in the Melbourne area. So things have been going really well for a period of time. And then, now this is the cases broken down from the Department of Health in Australia. So that's the total for Australia, New South Wales and Victoria. So Sydney area, New South Wales, Melbourne area, Victoria. Compared to Western Australia, there's nothing going on there. Brilliant. Tasmania, South Australia, Queensland, Northern Territories, all good. The cases are in New South Wales and Victoria. Sydney and Melbourne areas primarily. Now, the case is why. Well, there's a debate going on at the moment. The authorities seem very keen to deny the fact that it was anything to do with protests that went on the 6th of June. But 10,000 people, Victorians, attended these protests. There's quite a lot in Sydney as well. The authorities in Melbourne and Victoria issued a stern warning for people not to attend, but still 10,000 attended. So what kind of situation is this? The government is saying don't go, but 10,000 people say, well, no, we know better. We'll go. Don't worry about it. And now the consequences seem to be getting paid back. The authorities said we're in the middle of a global pandemic and we've come so far. So such a high price had been paid. It was appealed to people not to go to these protests, but they still went. And then from there, what seems to happen is people that went to the Black Lives protest, some of them seem to live in 9 particularly public housing tower blocks in Melbourne that were put into lockdown. I mean, most of them have been eased now, but so it seemed to get a few cases from the demonstrations that seemed to multiply in these particular areas. So it's a pity that people chose to ignore the authorities in Victoria. 1,800 cases of the virus are currently active in the state. So Melbourne with a real problem on its hands. Now, we don't know for sure. That there's a debate about what caused these increasing cases, but it could be the housing conditions, it could be the working conditions, or it could be these demonstrations. But it's a pity that Australia, having paid a high price and done so well, is now suffering an increase in cases, as we see here. Okay. All we need to do now is look at some of you. People who make this worthwhile. Otherwise there'd be no point. And as coincidence would have it, here we have Colin and Brenda, who are in South Africa. Now, I don't know what province they're in, but they're in South Africa, and I'm delighted to see that you're watching in South Africa, and I really wish South Africa and all the people in South Africa well. I do hope things are going to start improving very, very soon. This is Dan. There's a few camera shy people today. That's Dan in Cardiff. This is Francis, who put a cat on instead. But good to know you're watching, Francis. This is now who could this be? Let's try and work it out. There we go. So we've got Chris and Kitty the dog, and Kathleen. And at a guess, they're watching in Texas. Smart Texans wear masks. Amen, hallelujah. Thank you, Chris and Kathleen. Great to know you. The 3 of you are watching there in Texas. Thank you for that excellent picture. I know you don't need to wear the masks in your own homes, but obviously you're practicing and setting a good example for going out of the home. Good picture. And this is Mark, who watches in Manchester, who's forgot to put himself on as well. But good to know you're watching, Mark, in Manchester. This is Paul in Myanmar. Now, Myanmar is the country that used to be called Burma. And now, I don't remember the details here, but Paul's working on a project, and I think these people here were put out of work by the pandemic, so they're making these raised beds for food production, which is always good. And I try and grow food as well, so I'm always interested in seeing food production. So well done for organising that, Paul, in Myanmar, and well done for wearing the mask and setting a good example.